you have a mouthful of bad teeth, mouthful of periodontal disease, you're going to breathe in and the air passes by all that bacteria, and no doubt some of that bacteria gets sucked down into the lungs. Also, digestive diseases. You're chewing your food. If you're chewing your food in a mouthful of bacteria, where do you think that goes? You swallow it down into your stomach, and that can start to affect a lot of other systems. It definitely increases your chance of having a heart attack and the rest of the cardiovascular system, increases your chance of your risk of osteoporosis, your risk of stroke. Definitely, there's a big association between periodontal disease and diabetes. But what it all comes down to in the end is the longer your body's fighting a low-grade chronic infection, whether it's an infection on your big toe or it's a mouthful of bacteria, the more your body's trying to fight a low-grade chronic infection for years and years and years, your immune system is just working overdrive. And the longer your immune system is just constantly working on something that's constantly there and can never get better until it's removed, it reduces the effectiveness of your immune system, which can ultimately shorten your life expectancy. That's serious. So I go over and over with patients. The number one reason you should be doing this is to get back to an overall healthy state.